My name is Gail Hock, and I'm here on Cancer Survivor Awareness Day as a representative of the National Cervical Cancer Coalition, the Arizona chapter, and the Arizona Partnership for Immunization, TAPI, to talk to you about cancer prevention with HPV vaccination. I will never forget that night. It was a Friday night, 1982. My mom had come over for dinner. I was making dinner for my family. She was playing with my 2-year-old and my 4-year-old in the living room. And I picked up that kitchen wall phone and surprised to hear my doctor's voice after 5 p.m. on a Friday, calling me to tell me that I'd better sit down, that he found cancer in my cervix, and that I needed to come for surgery the next week. I was one of the fortunate ones. I had an early diagnosis. I had a physician that I trusted. I had health insurance, and I'd already had my children. Very important that I had already had my children. The surgery that I had could have resulted in an incompetent cervix, and it's unknown whether I would have been able to carry a child to term or not at that time. In 1982, we did not know about the relationship between HPV and cervical cancer. And it wasn't until 2006 that we had a vaccine that could prevent cervical cancer. Now we have a vaccine that prevents cancer, HPV-related cancers in both boys and girls. And it's so important that we all come together. And I speak to you as a mother, a grandmother, and a public health nurse, and a nursing professor as well. I'm recently retired. That we encourage all people who are eligible for HPV vaccine to get that vaccine and to complete the series. There's a little bit of difference for the age that you start. The earlier, the better. Can be started as early as 9. HPV vaccine is cancer prevention. Just like Melinda Wharton said when I was at a conference in 2014, Dr. Wharton from the CDC, preventing cancer is always better than treating it. So if you have influence over a young person's life and that you are able and willing to talk to them about preventing cancer in their future, please, please, please encourage completion of that series. I was lucky, I was fortunate, but do not leave it up to luck. Do not leave it up to luck. We have no idea what healthcare is going to look like in the future in the United States. None of us know. But we know now that we have a safe and effective vaccine that can prevent cancer in the young people in our community's future. Please join with me and the National Cervical Cancer Coalition and TAPI and prevent cancer in our children's future. We're not doing a great job in Arizona. About 50% of kids haven't completed the necessary series. So help me out. Don't let someone end up like I did with that phone call on a Friday night after hours to find out that they have cancer that could have been prevented with a vaccination series in their youth. And if you have questions, if you're worried, if you're in the same boat that I was in 1982, please contact us at the National Cervical Cancer Coalition. We're here to help, we're here to listen, and help guide you. And the Arizona Partnership for Immunization is here to help you understand the safety and efficacy of all vaccines, including HPV vaccine. Thank you so much for listening. I appreciate your time.